we'll be discussing about another space infection, that is Ludwig's angina. So Ludwig angina is basically derived from a Latin word angina ludovisi, and it is a firm, acute, toxic and severely diffuse condition which involves the floor of the mouth. Basically, it is a bacterial infection and it involves 5 spaces of the maxillofacial region. The first one is the submental space, sublingual space bilaterally, and the submandibular space bilaterally. So, in this condition, the infection will first involve one space and eventually it will spread and involve the interconnecting other spaces as well. And it will also spread on the contralateral side to involve the corresponding contralateral space as well. So basically the infection will involve in one space and eventually it will spread into the interconnecting other spaces, and it will also cross the midline and involve the corresponding spaces. The condition is usually caused by dental infection, and apart from dental infection, parapharyngeal abscess, mandibular fracture, submandibular salivary stone, soft tissue laceration and secondary infection of oral malignancy will also cause this condition to occur. Now coming to the causative agents, the most common microorganisms which are responsible for the causation of this condition is Streptococcus, Staphylococcus and bacteroids. The clinical condition of Ludwig angina will include bilateral suprahyoid swelling. It is hard, cardboard-like in consistency, and it is non-fluctuating and it is painful on palpation. The mouth remains open and the tongue is in contact with the palate. Trismus is seen in patient, that is, there is difficulty in mouth opening for the patient, and there is brawny induration or brawny swelling present in the submandibular and submental region, which is non-fluctuant and tender, and the borders of the swelling is ill-defined. Other than that, the tongue movement will be restricted and there will be increased salivation. The patient will have chills and fevers, and there will be difficulty in swallowing and breathing as there is obstruction of airway. Ludwig angina can become fatal if not treated at proper time, as it involves the spaces in the floor of the mouth, that too bilaterally, which results in elevation of the floor of the mouth, due to which the tongue comes into the contact of the palate and there is obstruction of the airways. The first and foremost thing in the management of Ludwig angina is the airway management. And to achieve this, the patient is allowed to sit in an upright position and supplemental oxygen should be provided by mask or nasal prongs. If the condition deteriorates still, invasive procedures such as nasoendotracheal intubation, cricothyrotomy or tracheostomy should be carried out under local anesthesia. Patient should be taken on antibiotics. Broad spectrum antibiotics should be started firstly. Most commonly amoxicillin and metrogyl are started, and pus should be collected in a syringe and sent for culture sensitivity test, after which antibiotics can be changed in case if resistance is found. IV fluid should be started in order to keep the patient hydrated. Incision and drainage should be planned. For this, incision should be given on the most dependent area in the submandibular region, bilaterally and submental region. Drainage of the pus should be done and debridement of the necrotic tissue should be done, after which a corrugated drain should be placed and it should be secured with 30 vicryl or 30 silk suture. Extraction of the offending tooth, that is the tooth which is infected, should be done. The patient should be advised to take soft liquid diet in order to keep the patient well nourished and hydrated and to promote wound healing. Proper post-op care should be done. In case if nasoendotracheal intubation was done, then the extubation should be done, that is removal of the endotracheal tube. Culture sensitivity tests could be repeated in order to see if there is any need for changes to be made, and observation for signs of further infection or sepsis should be done. So that was about Ludwig's angina. We'll see you in the next video. Until then, bye bye and take care.